The European Commission has been recommending gender-neutral HPV vaccination. In other words, vaccinating all boys and girls since 2021, when Europe's Beating Cancer Plan was published. And that was actually reinforced in the more recent, in 2024, the EU Council recommendations on vaccine-preventable cancers. So we now have very solid recommendations coming out of the EU on what member states should do. They are, of course, only recommendations. The EU can't force member states to do this, but they're very clear recommendations that all young people should be offered HPV vaccination with the target of 90% vaccination in girls and a significant increase in the vaccination rate in boys. I'm a bit unhappy about the fact they haven't said 90% for everybody. I think it should be 90% for girls and boys. It doesn't seem to make sense to differentiate between the sexes like that. But nevertheless, this is a big step forward. And as a result, we have seen over the past few years a really dramatic increase in the number of countries in Europe that are implementing gender-neutral vaccination. And in fact, every EU member state, all 27 of them, have either already introduced gender-neutral vaccination or have made a commitment to do so. So hopefully within a year or so, all 27 states will be vaccinating both boys and girls. And this is a huge step forward in terms of cancer prevention for men and women, males and females, and also, of course, to preventing the other diseases caused by HPV, chiefly genital warts and RP, which is recurrent respiratory papillomatosis, which is rare but a really nasty breathing disorder. So the recommendation now that's coming very clearly for Europe is that everybody should be vaccinated. And this, as I say, is a really important and significant step forward. The challenge now is to make sure that enough people are vaccinated, that we get to reach that 90% target. And unfortunately, in almost all countries, we're still quite a long way from that. And there's been actually a bit of a dip, perhaps unsurprisingly, during the COVID years. But there's still we still haven't really fully recovered from that dip, and there's still a lot of work to be done in terms of increasing vaccination rates.